My name is Dr. Vivien Brown, and welcome to the rounds. You know, this is ResilienceRx. What we believe is that healthier doctors equal healthier patients. I think it's a fact that we all understand and acknowledge, but probably we should be shouting this from the rooftops. Because if we don't take care of ourselves, if we don't have some focus on our own health, our own stress levels, then we can't possibly do a good job taking care of our patients. I think with the COVID pandemic, it's been a riskier workplace environment for everyone. And it's become even more important to protect our mental health, have social outlets, and remember that social connectedness is so important for our own well-being. You know, sometimes people ask me, what do I mean by social connectedness? And it's something like this. It doesn't have to be in person. It can be tuning into something like the rounds, the way we used to do rounds in the hospital, and really just talk to each other. And that's what it's all about today. My pleasure today is to be speaking with Dr. Stephanie Smith. She is an infectious disease specialist and attending physician, full-time medical staff at the University of Alberta Hospital and at the Mazakowski Alberta Heart Institute. Not sure I said that correctly, Stephanie. But in addition, she provides consultation for infectious disease prevention and control. And within the Department of Medicine, she's the program director of postgraduate training infectious disease programs. So she wears a lot of different hats in the hospital. And interestingly, she's also married to a physician. And I want to ask her some questions about the difference between her and her spouse and how they handle stress. But let me just start by saying welcome to the round, Stephanie, and thank you for doing this interview with me.
Well, thank you for having me. It's a pleasure.
I wanted to ask you at your hospital, and so obviously this is not all of Alberta or all of Canada, but at your hospital, are there specific steps that physicians can take to help manage their stress and improve their mental health and wellness?
Well, I think that, the last year has certainly been difficult because a number of ways that we can manage our stress is related to being connected with others and being connected with our community. And certainly the pandemic has put some restrictions on that, making it more difficult to, have rounds and to, in person at least, and to be able to connect with physicians. When I think about my division in infectious diseases, one of the things that we really loved doing was being able to all, see each other during the day and have lunch together and bounce cases off one another. And having that connectedness, I think, is incredibly important. And some of that has been lost with the pandemic, but I think that we really do need to think about other ways that we can connect with each other to maintain that ability to be able to, whether it be venting or just, being able to discuss a case or, talk about any really aspect of your life. I think that just having that connectedness is so important. And I mean, not just at work, but obviously at home as well. But, when we think about the workplace, I mean, this is our family to a large extent. We tend to work very long hours as physicians, and there's not really any way of getting around that sometimes. So I think that we do have to try to develop communities within our workplace where we feel supported and where we can reach out to people for help, whether it be, for a case or whether it be for our own help, for our own mental health.
Are there specific strategies or outlets at your hospital or in your facility that support physicians coming forward to talk about a difficult issue?
Well, I think I do think that there are some forums to help to, encourage that coming forward with issues or stressors or that kind of thing. But they tend to be a little bit more siloed. So I think that, certainly in the Department of Medicine, I think there's very much of a collegial atmosphere that allows people to reach out and, talk to our chair or talk to our divisional directors and that kind of thing if there are issues. But I do think that, it really does need to go beyond that and be more all encompassing for all physicians. And I think that some areas of medicine are much better at doing that and having check-ins for mental health and that kind of thing than others. And I think it's something we really do need to foster within the whole hospital setting, and not just for physicians, but for nurses and for other allied health.
Yeah, I think it's so important, and because if there's a structure, it's much easier for someone to come forward and access that structure, as opposed to thinking through who they feel safe talking to. And sometimes, their immediate supervisor is not necessarily the person that they want to share personal issues with. I want to ask you a personal question. It's not something you have to answer if you're not comfortable, but have you ever had significant stress, anxiety, depression in your career? And what, if you did, how did you handle it? How did you build resilience within yourself?
So it's a really good question. And I think, I've been very lucky that I don't think that I have had significant problems with depression or anxiety, but I think we would be lying if I said that I was never under stress. That's just not possible, right? And when I think back over, the 13 years that I've been in practice, I think the most stressful periods of time are situations where I don't have a lot of control, or I don't know what's coming in the future, or I don't feel supported. And so I think that, when I think about how to move forward and how to support my colleagues and trainees and residents and medical students, then I think that, trying to allow them to have some control over their schedules, their lives, is so important. And again, having some structure around what they can expect, I think is incredibly important. And then really trying to make sure that we are all supporting each other, and that everyone knows that we are, that I'm grateful for people's support and vice versa. So I think that, definitely I've had periods where I've felt very overwhelmed by my job, and often my job plus the rest of my life. So, my job and my young children, and my job and other things, family issues and that kind of thing. And I think that what gets you through is that you do feel supported, you do feel valued in your job, and you do have some control over all the aspects of your job.
I think you've summarized that incredibly well when you talk about the lack of control, the lack of knowing what to expect, and the lack of support as being three things that in combination can really make someone feel vulnerable. And sometimes we may be able to bolster part of it. We may be able to bolster the control, or we may be able to bolster the support, but we still may have a lot of unknowns. But I think you phrased that really well, because I know for me personally, and maybe it's that little bit of being obsessive compulsive, but when I know what to expect, and when I am in control of my schedule, my commitments, however you want to phrase that, I find my stress level is much decreased. And when there's too many balls in the air, then I find that stress is really increased. And is there anything sort of fun in your life that you would do for quick relief? Like, I don't know, I'm not a dog person, but some people love going to the park with their dogs. Like, what do you do when you just really need to sort of let it all out?
Yeah, I am a bit of an exercise fanatic, so I do feel like, and I'm also very much a creature of habit. And I do think that having structure in your day, especially, during this time where we're in a pandemic and people's lives have really been upturned and some people are working from home, creating some kind of structure, I think, is incredibly important to our mental health. And so I do make it a habit of trying to get some exercise in every day, and it might be 20 minutes or it might be an hour, but it's something, and something's always better than nothing. So I think that that's important. And then, I do think, as much as, it's sometimes challenging to juggle children and job and husband and everything else, your kids are the most amazing release, I think, of stress in a way, because they put everything in perspective, and, you're kind of forced to really focus on them. And that is, as much as it's hard, it's a good thing. And I do think that, having that time where you aren't able to answer your emails and make phone calls and keep on working and actually be able to focus on your kids and do something fun is actually, at the end of the day, allows me to keep coming back to work every day and, working those long hours.
Yeah. I think it's also really sort of a good habit to give whatever you're giving 100%. So if it's time with your kids, put down your phone and don't answer the emails, and count the chocolate chips and the chocolate chip cookies so that it's fair that everybody's getting the same thing, and do whatever it is that you need to do so that you're with your kids 100%. And then when you're at work, you can concentrate on work 100%. I think when we try and do everything, when we worry about our kids when we're at work and worry about work when we're with our kids, we don't do anything properly.
Yeah, I agree. And I think that it took me a really long time to figure that out. I think, people that are often early in their careers also have young kids. And it can be really challenging because you feel like, you're just starting your career and you really need to be giving your all, and you feel like you're never good enough at work and you're never good enough at home. And somehow over time, I think, people do find that balance. And as you said, it's, I think it's really trying to become efficient at work and put your all into work. But then when you go home, then, at least for a period of time, you really just need to separate completely and focus on your kids. And, 2 hours of focus on your kids is going to be way better than 4 hours of you intermittently, trying to do your PowerPoint presentation or answer phone calls or whatever. And, then I think your kids are going to get frustrated and it's not going to be a good outcome.
It's really interesting. We're at different life stages. My children are grown now, and sometimes I'm with my grandchildren in the park and I'm watching them on swings and on, the playground equipment. And it drives me crazy when I look at the park bench and I see parents absolutely hunched over their cell phone, not watching their kids, not caring what their kids are doing. And, I'm sure they care, but they're distracted. And, it's one of those things that I think is disappointing when we see how some people are sort of handling being with children and not giving children the attention that they value so much. Mm-hmm. Can I ask you what kind of a physician your husband is?
He's a general surgeon and surgical oncologist.
And do you find that his stress level or means of coping or how he handles sort of obviously a pressured, busy schedule similar to yours, does he handle it differently? Are there different mechanisms or different go-to areas that work for you that wouldn't work for him, or vice versa?
Yeah, I think that, I think some of the stressors that he deals with at work are a little bit different in that, his schedule is much more unpredictable in a way. When he's on call, he's often up all night operating, and, he does very large, complex cancer surgeries. So he often has a number of people in hospital that are very ill and tends to be awake sometimes at 2, 3, 4 in the morning worrying about his patients. And I think that, his escape, a couple of his escapes are, he's an avid reader. So, I think he does read to escape, which is great. And then it's certainly sports as well. So being out on the golf course for him is something that's, I think, a good escape. And he's also, he has a really good group of friends, not necessarily all here in Edmonton, but scattered around the world, that he keeps in touch with, which is amazing. And I think that that's certainly, is something that he really draws on for support.
It's interesting in some of the research around cognitive decline, as couples age, men often find that their wives are stress reducing for them, and women often find that their spouses are stress enhancing. So it's great that he has his own mechanisms, his own friends, his own choices, and that it's not falling to you to be a stress reducer for him, other than being an important partner. I don't mean to take that away from a couple and from a marriage, but it's important that we don't just rely on our spouse in terms of stress reduction.
Mm-hmm. And I think, as much as sometimes it can be challenging because we're juggling and, we're both quite busy, I think that there's a certain level of understanding that we have of each other's jobs that you just couldn't have unless you really knew what the other was going through. So I think that certainly, during this last year where I've been busier than normal with the pandemic and planning in our hospital, he's really had to step up a little bit in terms of managing some of the things around the house. And, he, I think, has more of an understanding than maybe if he wasn't a physician or wasn't in the medical practice.
That's important. It sounds like you have a good relationship.
Mm-hmm.
Do you have particular recommendations or thoughts on how we could look at health policy in Canada that would support physicians coming forward with stress-induced illness? Is there something that we should be aiming to encourage people to do, or our MPs to talk about? What can we do on a broader level? So what can we do outside of our own specialty, our own hospital? Is there something that you think that would be beneficial for everyone?
It's a good question. And I think one that's hard to, trying to create policies may be a little bit difficult. I mean, I think that we should be looking at mental health just like any other illness and giving it its fair due. Just like if you broke your arm, I mean, there's no, and you have to be off work. If you have anxiety or depression and you need to be off work, they should be managed similarly. And the support should be there, in a similar way. But I do think also that we really need to work harder at a medical school level and even a residency level at really trying to prevent these issues from coming up. And obviously you can't prevent all mental health issues, but I think certainly when we look at things like physician burnout and, job-related stress, then I do think that there are certain things that we can do early on in training to really make people aware about their own symptoms and when they should, what are those kind of triggers for burnout and what symptoms should you be looking for in yourself, what, talking about it with your social community so that if you don't have the insight that you have a problem, that hopefully others will be able to recognize that, it's not just that this person is grumpy. There's something deeper there and there's something that needs to be addressed. So I think that needs to be addressed kind of earlier on in training. And part of it, I think, again, is really trying to make people understand that this is a stressful job, unfortunately. Being a physician, we have, patients' lives in our hands, and it is going to be stressful. And we're asked a lot. We ask a lot of ourselves, and people are going to ask a lot of us. And so, how can we ensure that we are going to be as resilient as possible? And that kind of resiliency training, I think, is incredibly important.
I absolutely agree. One of the things I tell the medical students and residents that I work with is after you see a patient, you shouldn't be going home worrying about that patient. Because if you're worrying about that patient, maybe there was something else, at least in primary care, that you could have done. And if you're thinking, should I have done this or shouldn't I? It doesn't hurt to ask a colleague, to phone any physician. I think physicians are by nature collaborative. I think people are ready to come to the phone and talk to you about any case. And, when you've got that level of stress and you're not sure about how you've handled something, it's often so incredibly satisfying and such a relief when you talk to a colleague and they say, yeah, I would have done the same thing. I'll wait for these results. Just the idea of coming up and speaking to someone when you're anxious about something, because that anxiety may not be about you. The anxiety may be about something that you've done or something that you've handled or how you've handled it. And I think, the understanding in other professions like pilots, when there's an error, everybody talks about it. Everybody learns from that error. Where in medicine, when there's an error, somehow it's put to the side and somehow there's not necessarily that discussion. And so when there's an unknown, and this goes back to what you were saying about unknowns and control, I think when you share it with a colleague, it's so stress relieving to really talk about something.
Absolutely. And I think, we all encourage each other to run cases by us, and I run cases by people. And I think, it's having that community of practice that's so important, and certainly adds to the resilience, because then you're not, as you say, you're not going to take that anxiety home, or you're not going to continually be second guessing yourself. It's better to certainly just reach out to a colleague and say, so this is what I did. What do you think? And, 95% of the time, they're probably going to say, I would have done the same thing. Or maybe they have a great idea and they say, oh, you should try this. And you'll think, oh, that's wonderful. Right. So I do think, we do need to be in a culture where we can look at, how we're practicing and how we can do better. And it's not a blame, or it's not a, we need to learn from our errors. We are human and we are going to make mistakes, and we may miss things. But if we don't learn from it, then we're never going to do better.
I like to think that medicine, in its sense of being collaborative, is really a team sport. And we're all on the team. My husband is a lawyer, and from the get-go, it was not a collaborative. It's being in law is not collaborative. You're looking for the holes in someone else's argument. You're looking for the holes in the contract. You're looking for where someone may have slipped through the cracks. Whereas in medicine, it's quite the reverse. We're really looking to be supportive, and it's all for the good of the patient. And I think that idea of starting in medical school and starting with residents to encourage people to share information really does enhance resilience. I think you must be a very good teacher, Stephanie.
Well, I don't know. I try. I certainly like teaching. I just came off a week of consult service, and I had this amazing team, and they're young and they're keen, and it's just so fun to watch them and to watch them learn and be excited about cases. And so, seeing that is certainly, if you're feeling in a bit of a slump in your job, then, seeing all these young people that are really excited about seeing patients and everything is a wonderful thing.
Yeah. And I think when they see you excited and you enjoying your work and you connected, it's incredibly reassuring to younger physicians and medical students and residents to really understand the connection that you have with the work that you do. I could see that you could be a very good teacher. I think you've shared some really incredibly important things with us today, with me today. Do you have anything that you want to add to this discussion, something that you'd like to see being done differently, or want to share something that's being done really well in your environment that you want the rest of us to know about?
Well, I don't know if it's something in our environment, but I do think that, one of the things that I feel so grateful for in my job is that I get to work with this, incredible team. And so I think sometimes physicians forget that there's this whole team of other people that are not physicians around them. And I think we really need to capitalize on just the incredible expertise that our nurses have, and our physio and our OT, and, in the hospital setting at least, because, through this pandemic, I've gotten to work with nurse managers and nurses and all sorts of people that we would not have been able to get through this pandemic without all of them helping me in infection control. And so, I think it makes you realize just how much, there's the physician family, but it's much broader than that. And that they have, all sorts of expertise that we don't have, and we need them. So really, again, fostering that, incredible healthcare community, not just physician community, I think is really important.
I think that's a really good lesson. My final question for you, you're in Edmonton. Tell me, can you hang out at the Edmonton Mall?
No, it's like the worst. I avoid the West Edmonton Mall as much as possible. Occasionally, my 13-year-old twins want to go for one reason or another, but it's about a once a year event that I will go to the West Edmonton Mall.
Okay.
Not really a mall person.
Fair enough. Thank you so much for being with me today. Dr. Stephanie Smith, infectious disease from Edmonton and infection control. My goodness, is there a more important area of medicine right now in the hospital? I don't think so. So thank you for being with me. I think it's been very helpful, and I hope people listening to this interview really will take home some of your messages. I like the message on control, on knowing what's happening, on social connectedness, and on taking time for yourself. I like the fact that you exercise. That's something in primary care we talk about all the time. So it's nice that you don't just talk the talk, but you walk the walk. Thank you so much.
Thanks very much, Vivien.